Ingrid, you tell me when to start. Have you heard back from Cliff about getting?
All right, it's a go.
All right, we have Cliff, I can see. Cliff, you need to unmute yourself. Everybody else make sure you're muted. I think Ingrid's taking care of that. So, tell me when to go, Ingrid.
You're on.
All right. Good evening, everybody. Thank you for joining us on our second Zoom call. We are going to work this out and we're going to get it perfect at some point. But in the meantime, thanks for joining us this evening. We have Councilmember Cliff Lentz and myself who are here on the call. And we have a special guest, Dr. Sachin Gupta, who is a pulmonary and critical care physician who is very familiar with COVID-19, and he lives here in Brisbane. So, and he reached out to us and asked if he could help, which was absolutely wonderful. So we are going to turn the initial part of the meeting over to him so he can answer some questions. We put a few questions together and put to him from things that both Cliff and I had heard from within the community. And so Dr. Gupta's had a little bit of time to look at those things. He's going to just speak in his own words and talk to us about, what he thinks is really important for us to know moving forward. And I'll just turn it straight over to you, Dr. Gupta. Thank you so much. We are very grateful that you stepped forward and offered your services to us as a community member and an expert in this area of pulmonary medicine. So over to you. We'll need to unmute yourself, or Ingrid, can you unmute Dr. Gupta? There you go.
There we go. It's a great honor to be in front of fellow citizens of the city of Brisbane and with you. I think it's important that we're able to sit together and talk about an important issue that's in front of us now, which is this pandemic, and in so many different ways that it affects us. As a little background to myself, as Karen introduced me, I've been practicing here in the Bay Area for the last 6 years, and have seen, even before practicing here in the Bay, the flu of 2009, 2011, we had a bad flu strain. And this is something obviously very different, and something that affects all of us in a very personal way. So I can speak to certainly the experiences in the hospital and what that's been like, but even as a father to a newborn that's 3 months old, and the concerns of having a newborn child at home and him getting infected, having elderly folks in the nearby area and those concerns, and some real world issues that I know many of us here in the Bay have to think about here in Brisbane. I think what's novel about this situation is just how easily spread this infection is. And it's so different than what we've seen in other illnesses like influenza over the previous years. This came on pretty quickly if you think about the time span that we've had over the last few months to now where we're seeing millions of cases, tens and thousands, hundreds of thousands of folks dead across the world. In my real world experiences, just practicing here in the local Bay Area, I've been pulling some shifts to help out at Seton, which many of you know, Seton's been having some issues itself, but fortunately the state was able to step in and stabilize the hospital, which has been great and helpful for quite a few patients that are in there. They have a dedicated hospital ward for patients with coronavirus who have tested positive or who are suspects for coronavirus, as well as an entire ICU dedicated, a 12-bed ICU that's dedicated just for patients with coronavirus. And what I've seen is, again, just a lot of very, very sick people who are on the ventilator. And part of a critical care physician's job is taking care of patients on the ventilator, putting in central lines, doing diagnostics and procedures, and really doing the types of things to hopefully get patients over the hump. And really what we're seeing is folks, what I've seen is folks in their 70s and 80s with chronic health conditions really being the ones affected. What personally affected me as I was taking my first few shifts was seeing family members, and in particular one family member of a patient who was already in the ICU. She herself was admitted to the ICU, just 3 beds down, with also had so that hit home, seeing someone get that sick, and this family member who was doing right by taking care of their father, coming down with such a severe illness was really personally quite touching. So it takes vigilance and for all of us to really prevent the spread of this. And there's a lot of fear and anxiety for all of us is what can we do? What are the signs and symptoms of the infection? And what is our future looking like? And I think through some Q&A, I think we can really get to that. And I'm helpful and glad to see so many folks here online so we can talk about that. Just off the bat, many folks have questions about social distancing and the masks, and that the whole mask saga has been really interesting. And I can imagine many folks have questions and concerns about masks. And I'll just go ahead and address that because I think it's an important one. Social distancing is the backbone for us to get over this pandemic. By social distancing, we're preventing each of us individually from getting infected, or if we are infected, from spreading the infection to other people. Because this virus seems to spread in a logarithmic fashion, as we've seen all of us in various forms of fashion during the years, it takes a couple of super spreaders, or even not super spreaders, to infect a vulnerable population, and then more people from there spread to others, and so on and so on. So the social distancing component is how we've seen in our neighborhoods, in our cities, and our counties, mitigation be as effective as it has. And while we've seen a lot of cases, in particular our colleagues in the South Bay have seen a lot of cases, I think we've been quite fortunate, San Mateo County and San Francisco County, to not have seen a terrible influx. We've seen a lot of patients, but not the type of devastation that was once feared. So going back to social distancing, that's just such a big important part of this. Where masks fit in is to say, as we're looking forward to the next tomorrow, the next day, and the day after, are there things that we can do to help us reduce the chances of the droplets that we all produce from affecting the person next to us? Because some of us are going to many of us are going to the grocery store, many of us are going to the pharmacy, some of us are going to see our doctors for conditions unrelated to coronavirus, etc. And the droplets we all create can potentially infect someone else. And it's hard to know if we've been infected or not. Many of us will never have symptoms of coronavirus. And that's where the homemade face masks have a role in reducing the spread of droplets. And we can dig into that more, the idea of droplets versus aerosols and how this infection spreads. But I think that we're seeing a lot of movement towards masks, and I think it's an important one. The confusion arises is that several weeks ago, we saw federal authorities and CDC suggesting that we don't need masks. And the confusion arises there was such a shortage. And I think that's key for everyone to understand. That hospitals, even till today, even at Seton down the street, which is getting state funding, don't have abundant resources of PPE or personal protective equipment or N95s. Personally, I had to use the same N95 for 3 days, the same respirator that would prevent infections. They were only changing them out if they were getting visibly soiled or damaged or something like that. So I think part of the issue with the masks and why many of us have seen some shifting sands on the mask is because initially there was a terrible shortage of it as retailers were selling masks to everyone. Now we're seeing a little bit of a catch up for our hospitals locally and nationally for some of the equipment to get to the professionals it needs to get to first. And I think we would all agree with that. In the meanwhile, for all of us in the community, including myself when I'm going outside, wearing a simple mask is, again, in as much about protecting ourselves, more so about protecting the person next to us the person downwind of where we are. So anyway, that's I thought I would just hit a few highlights, both about my personal experiences and I think a key issue about social distancing and masks. And I'm happy to dive in further with folks' questions you might have. And I know we have quite a few questions that we can use as discussion that Mayor Cunningham and I and Councilmember Lentz have also looked at and put together as topics of discussion that might be very interesting to everyone.
Okay, so before we move on and start opening things up for people to ask questions, I really need to make it very clear that, you know, Dr. Gupta cannot answer any personal questions from a legal and liability perspective for both himself and the city. So all of the questions need to be generic to COVID-19 and, you know, what that means to you, to your community, what you've heard. I know he's going to be able to dispel some misinformation that is in the community all over our country. So Cliff, unless you have something you want to add right now, we could open up a discussion for Dr. Gupta to our guests who are online with us.
Yeah, you know, I do have a list of questions, but I think it's best to hear from the public first and have the public ask the questions. And if there are still some questions that haven't been answered or asked, then yeah, then you and I can follow up with questions for Dr. Gupta.
Okay, so I'm going to mute myself, and I don't have the hand raising in front of me right now. I don't know what happened to it. 1 second, please.
So if folks who are
Can you see
participating
it?
in the virtual town hall, if you could please raise your hand if you have any questions for Dr. Gupta. You can do that by either pressing on the Manage Participants button, or if there's like 3 dots on your phone, there's also an opportunity for you to click on the Raise the Hands button.
Can you see that, Ingrid? Because it's disappeared from my screen.
I don't see any questions or any hands raised right now.
I see one that's made its way to the group chat, which I'm happy to take. And
Okay.
as much as folks are comfortable either submitting them via the Zoom chat or using the raise hand button, either works. But I can start with this one, as folks are getting used to maybe playing around with their settings on the raise hand function. Why don't I take this one? Our older, and the question, and I won't name names. We'll keep this as anonymous and HIPAA compliant to use medical jargon as possible. Are older adults still more susceptible to the virus if they do not have any pre-existing conditions? The short answer is yes. We know, all of us, in our immune system changes over time. And that's those of us who have crossed, and it's not precisely known for any individual person is 65 versus 66 versus 64, but 65 has been looked at for many research studies over time. And epidemiological studies have really shown that really it's the above 60, closer to 65 age range that sets folks to be more susceptible to communicable illnesses. And that dates back to flu. We have tons of data about influenza over the years, streptococcal pneumonia. It's two of the best examples off the top of our heads. And this virus, in terms of what we're seeing in the real world and the epidemiological data that we have so far, is indeed age is playing a large role here. Now, of course, that data in specific to coronavirus is a little tricky in that we don't have a huge database yet to tease apart patients who have pre-existing conditions or health conditions and are above age 65. As you can imagine, many of us, in fact, not most of us, above the age of 65 will have a chronic condition or two. That's very common. It could be high blood pressure, it may be diabetes, it may be some degree of coronary artery disease. These are very, very common. I think erring on the side, and again, based on what we know about other conditions, age in and of itself plays a role in our body's systems and ability to ward off infections. And so even if you are or know someone who's at age 65 and above, but in excellent health condition, I would still err on the side of extreme caution and still take the same precautions as someone you may know who's 65 and with a health condition, because it's just about the immune system. And we do know that as we age, our response, our immunological responses do change as we age. So
we have another chat question, Dr. Gupta.
Okay. Yeah, here it is. Is it known how long the virus will live, be in the air or in body fluids? Okay, yeah, that's a good and good question. And I'm going to keep my notes also here, so I have that ready. Okay, so the general question of how long the virus will live. If you mean on surfaces, that's maybe different generically than how long do we expect this to go on for. So I'll answer this first from the question of how long do we expect this virus to last for. And based on what we're seeing from the CDC data, what we can compare this virus to other viruses, as you may or may not know, this is SARS-CoV-2 or coronavirus number 2. There was in the mid-2000s a coronavirus 1, actually, that was seemed to be as almost as infective or as contagious as the current version, but way less impactful in terms of the severity of disease it was causing. So in terms of the virus living, we know that virus actually didn't live for very long. The concern for this is because this is seemingly very contagious, and we have the northern and southern hemispheres, that the concern for many, and it's not proven yet, is that this will, even as we get into warmer months, and there is some hope or belief that as the warmer months come, we might see the virus get relatively inactivated, but then shift over to the southern hemisphere where it's colder. And then as we know with global travel, this may ping pong back and forth until a truly effective solution comes like a vaccine. So again, to the question of how long do we think this virus will live, in a generic sense, there's no set timetable. This could be indefinite. And many folks are estimating at least till 2021, 2022. The key thing will be the vaccine. Now, in the meantime, it's about control, because this is impacting all of our lives dramatically. I mean, it's impacting your life, people's business lives, people's work lives, people's social lives. People are getting sick. And so that's the bigger question. And that's where, if we can control this, if we can contain this disease, then we reach a scenario where maybe things can slowly get to some sense of normalcy. And that's where I think that's an entirely different question, and a very difficult question. To the related question, which is how long does it last in the air? And then subsequently, how long does it stay in body fluids? We know, I'll tackle the second question about body fluids first. There have been a few studies that I've seen. One was tears, and actually in a study out of the Journal of Ophthalmology showed tears do not seem to harbor the virus. So that's pretty good news. Urine, I haven't seen too much either way on urine. I think it's leaning more towards it not transmitting through urine. In stool, on the other hand, there have been virus particles detected in stool samples, which relates to why if you know someone or yourself becomes infected, it's recommended to minimize sharing bathrooms with others if possible. So we know stool might be a place where folks can get, the virus might get transmitted. We know it's there, we just don't know how much of that would actually infect someone. The biggest, of course, and the most important body fluid to be worried about is droplets. That's sneezing, coughing, and to a much, much stronger degree, talking. We generate droplets, they go in the air, and mostly within 3 feet, drop down immediately, land on the surface, and don't tend to get aerosolized and go downstream. What you might have seen in the news is that they're detecting some aerosols. Aerosols are droplets that are small enough to linger in the air for a little bit longer. And what's confusing is we're seeing reports of aerosols, that the virus is living in aerosols, and we need to be concerned about potentially catching the infection from the air if it's lingering in the air for 3 hours. I think the odds of actually getting infected from air that's been lingering in a room for 3 hours is very, very low. And that's because, again, it's really in the droplets and the larger particles that we inhale in, are we more likely to get enough virus to infect us. When we think about getting infected, it's more than just breathing in one virus. We don't know exactly how many virus particles it takes, but we know it takes at least a decently large amount. And there's still so much more research being being done to see how many virus particles it actually takes to get infected. And you may wonder, do we even know that for influenza? We don't know that for influenza. We don't know that for other forms of pneumonia. So it's a very difficult question about, again, how long does it last in the air? Because it leads to the more important question is, even if it is in the air, is that likely to infect us? The key measure here is the 3 feet rule, because that's where droplets can be in the air. And those droplets, if you're near someone within 3 feet, 6 feet, I keep saying 3 feet, I apologize. I don't know why I keep saying 3 feet. 6 feet, it's 6 feet is the distance that you want to be within someone's radius to avoid breathing in those droplets. In terms of surfaces that it lands on, there was a study, and that's why I had to pull up my notes, looking at, looks like copper, virus particles were found on copper for up to 4 hours, cardboard for up to 24 hours, and plastic and steel for up to 72 hours. So those are surfaces that need to be, we all need to be very mindful of. And the biggest one is door handles. I think that's when we're entering our own homes, or we're going to the grocery store. Well, not too many handles at grocery stores, but you get the point. But that's a source of concern. So I hope that answers the question of how long does the virus live on surfaces and in the air. The risk of those is low. So I don't want folks walking away from here saying that they need to wipe down everything. I think the panic of will I get infected should be tempered by keeping in mind that there are likely things to get infected from, and then there's things that are far less likely to get infected from. So even if you happen to be outside and you're keeping a social distance of 6 feet and someone comes within 5 feet, again, I don't want us to lose the forest for the trees and let perfect be the enemy of the good. We need to do our due diligence. And if we're doing that due diligence, I think we'll all do well for ourselves and for each other. So, there's a lot of fear and a lot of anxiety about how, are we at risk of picking this up? And I think as much as we follow the CDC guidelines, the vast, vast majority of us are going to be fine. And the good news is that despite of what I'm seeing in the hospital, again, most of us here are doing great, and will continue to do great throughout all of this. Hope that answers that question. The next one here is, there's various information regarding how to clean the cloth mask after wearing. Spraying the mask after use with alcohol or peroxide and air drying effectively killed the COVID-19 infection. Yeah, so that's a great question. With now use of home masks, that brings up a real world question of how do we keep them clean, and how often do we need to keep them clean, and what are methods that will keep them clean. Yes, hydrogen peroxide is fantastic, and that should kill most of it. And air drying with alcohol, those are all great techniques. But honestly, even just really hot water and letting it be submerged in hot water and then letting it dry should be adequate to really kill this bug. So kudos to you for doing the masks and creating that and being mindful of the mask. The other factor is in handling your masks, right? So if it's been on our face and air particles are hitting it, and our noses are kind of vacuuming in air into our nose, so the mask itself might have germs on it. So also be mindful about, as you take off your mask, that try not to touch the middle of it, because that's likely to be the place where most of the germs are. So just keep your hands as safe as possible. Just touch the ends and wash those, and then wash your hands before and after, and you're likely to stay safe in that process. So really good question there. Here's another one. It states, if you get tested and are found negative, how long is the test good for? Realizing that the tests are initially done on individuals with symptoms, but after, I assume everyone will get tested. This is a really great question. I think one that between Mayor Cunningham and Councilmember Lentz, it came up in our queue of questions, which is, generically speaking, testing. So I'm going to just take a giant step back and for us to discuss testing just in a nutshell, not in a really long way, but in hopefully hitting some highlights. So what testing involves now is a nasal swab, and if you've had it, it's not very pleasant. It's a long plastic with cotton on it swab that's inserted into the nose, wiped around the mucus in there, and fairly deep, so that's what makes it uncomfortable, and removed. Then put carefully into a canister, and the canister is then sent to the lab. The process has to be done properly, because if it's not deep enough, you're not getting enough mucus. If it's not swirled around properly, you're not getting enough virus particles. So testing has to be done right. But assuming you've gotten a good quality test, what you're testing for is viral particles. So the actual virus, the DNA of it, which is actually the RNA of it, the coding of it. You're looking for parts of the shell of the virus or parts of the actual DNA or the RNA, actually, the coding of the virus itself. That's put into a machine which multiplies it and makes it possible to determine if any of it's there. So in finding out if someone who's had symptoms of the infection, and to answer the question if they're negative, first of all, the first part is this test is not 100%. And I'm not saying that to raise concern, but to an issue that healthcare providers ourselves are facing real time is if we have a patient who really looks like they might have coronavirus, have all the symptoms, features, the lab results, et cetera, that are suggestive of it, and they get a negative test, does that mean they don't have it? And as you can imagine, no test ever, none of the tests we've ever used in healthcare is ever perfect. And we think this test is about 75% perfect or 80% perfect. So there's a little bit of that wiggle room. But with in mind that some tests, a very few percentage of tests will be negative falsely, but majority will be positive or negative accurately. And the question of how long does that mean you are protected, I guess. I think that's sort of the crux of it. So we all want to know that. How long are we going to be protected if we've already gone through the infection or if we've tested positive, and how long is this going to be affecting us and our immunity? And the DNA test, or actually RNA test, only tells us a small window of time. Do we have the virus or not? It doesn't actually tell us about our immunity to the actual infection. And that's where you might have heard about antibody tests. So all of us, as we suffer through various infections, and we're all bombarded with infections throughout the year, the common cold or minor sniffles or earaches. So we all develop antibodies to various infections. And those antibodies are what tell us if we're ready, if we're exposed to the same bug again. So I'm hoping I'm answering the question correctly, which is that to kind of more in an overall sense, tell you how kind of testing works. The viral swab is only to tell us if we have the virus at one point in time. The antibody test will tell us have we developed immunity or antibodies against the virus? And that, now the question of that is another tough one, is how long would someone be immune for? We know the flu virus, for example, we have to get an annual flu shot. For the Tdap vaccine, we have to go every 10 years to get a booster, right? We don't know yet for the coronavirus what that's going to look like. Is getting infected once, or in the future, hopefully getting a vaccine once, is that going to be a lifelong protection? Is that going to be a 1-year protection? How long will we be immune for? It's an important question, and one that we need answers to soon. But this being a novel virus, it'll take some time for the researchers to get to an answer to. So a really good question there. All right. Oh, and the last related question, will everyone get tested? In an ideal world, yes. And I think the government is going to have to, local and state and obviously national government is going to have to look at that, because it's not going to be an easy thing in the initial rollout to get this rolled out to everyone on day one. So we're going to have to look at the high risk populations first, right? Who are the people that we worry about having immunity? Who are we worried about people who could potentially spread the infection? What we've seen, if you've seen the data, which is really scary for those of us on the front lines, is at least 9,200 clinicians, that's between nurses and doctors, 9,200 worldwide healthcare workers have been infected by this disease. So that's pretty bad. And those are just the ones who report it in some form or fashion. Many of us get little colds or coughs and we may not be reporting it. So the testing algorithm is important, and probably, from where I see it, is going to be targeted probably for healthcare workers first, because it's healthcare workers who work in nursing homes, who are taking care of elderly patients in nursing homes. It's doctors and nurses who are part of the community, whether it's here in Brisbane or everywhere. We're super spreaders in one form or fashion. And so knowing if I'm immune or not, or if a nurse is immune or not, or a nurse practitioner, I think it's going to be one of the first populations that's going to be tested. And then from there, rolled out first. So you can imagine it's going to be a huge undertaking and a time consuming and a large undertaking and a very expensive one. So much to be determined and more to be seen, and an important question. Last question I'm seeing in the queue here, and another good one is there any info on whether direct sunlight reduces the time that COVID-19 will live on surfaces? We know bacteria seem to respond and be affected by UV light. So the idea with sunlight is the UV rays that seem to disrupt the DNA of bacteria. We have a bit less evidence when it comes to viruses as a whole, and specifically this virus. But this virus really shouldn't behave too much differently than other viruses. So insofar as UV rays, the UV, why shouldn't we all be in the UV more? The idea is, skin damage and melanoma. The same idea applies to bacteria and viruses, is that the DNA and the RNA of the viruses and bacteria get affected by the sunlight as well, by the UV. So plausibly, yes, we don't have factual data in a hard way, in a concrete way, to say that sunlight is a means to reduce infectivity or the viral burden on the surface. So if you have, if you're thinking about maybe your mask, putting it out in the sun, then maybe that's where the question is going. Not a bad idea, but I would still err on the side of things that we know will absolutely kill it. So the hydrogen peroxide or extremely hot, just the hot water, we know those will be very effective. I can't tell you, putting it in the sunlight or anything in the sunlight for X number, how many hours will it need? Is it midday sun? Is it morning sun? I think those are important questions and we don't have the answer to. So is sunlight helpful? Does UV radiation damage DNA? Yes, but in a concrete way, I can't answer that. So really good question there. In terms of questions on the Q&A, at least on the group chat, that's all I'm seeing. But I don't know if we have folks who want to either do the raise hand technique or where we are with that.
Okay, I have a couple of things to just add in here before we do that, if you don't mind. We keep being told over and over again that soap and water is the best friend for disarming this virus. And I think a lot of information has been put out there now that soap, the actual lipids, the fat in the soaps are disrupting the entire molecule of this virus. Is there a particular soap that is better than the other? For example, is the liquid soaps really effective, or the good old bar soap that's really fatty? What should we be looking at, or doesn't it matter?
Yeah, it's a good and tough question. To my understanding, there's not any one particular type of soap. Part of hand, there's a couple of components that go into hand washing. A is the chemical effect of, yes, like you're talking about the lipophilic effects of soap, or the antibacterial effects or the antimicrobial effects of soaps. That's one part of the hand washing technique. The other part's mechanical. So actually just physically rubbing your hands back and forth. And corny as it sounds, I mean, this is gonna sound super corny, but it's not that. Healthcare workers, we actually go through compliance training ourselves for the mechanical aspects of hand washing, because as simple as it seems, I mean, we've been doing this since we're 2 years old. There's a right way, there's a better way of doing it, and there's bad ways of doing it. I won't say right or wrong, but there's better ways of hand washing and there's worse ways of hand washing. So it'll take literally 30 seconds of your lives just to watch the mechanical process of how to hand wash properly. So to answer your question, I think there's the mechanical part of how to properly hand wash, and then there's the hot water component of hand washing. And I think you need all three to effectively get virus off. I think that's going to be more important than the type of soap you use for your hands, whether it's bar soap or the Dial antimicrobial one. Certainly the advertising for some of these brands is pretty strong. That, you look on a bottle of Dial, it says, it kills 99% of bugs. And there may be a component of that, but I assure you, equally important is, again, the mechanical component, how long you do it, and then the ideally using hot water. As warm of water as you can reasonably tolerate to wash your hands.
Okay, I just want to remind everybody that this is being recorded for everybody to come back to in the future, youtube.com/Brisbane. So people can come back and look at this. And before we open it up to general questions, I'm going to pass it off to Cliff to see if he has any comments before we move forward.
All right. Well, hey, thank you, Madam Mayor Pro Tem. Yeah, thank you for those great answers, Dr. Gupta. It's really nice to have someone in town as knowledgeable as you to, just to share the information that you've collected and have experienced, in the field. So, a lot of us, of course, we get our medical information about COVID from watching TV. We're lucky as council members, we're able to be briefed by the county manager and his team of medical experts. And that's been really, really helpful. One of the things that you talked about, is in regards to who are the most susceptible. And, it's really interesting, when you look at the data from San Mateo County and obviously the older people are more susceptible than people who have compromised immune systems. But and also this goes to the amount of testing that's been done, which has been woefully, not appropriate for what needs to be done. But in the county, the number one group was the 31 to 40-year-old segment.
50.
31 to 50. Okay. Yeah, which was just like, okay, what's going on here? More people, at least in the amount of tests that have happened. So, so this goes to my question, Dr. Gupta. So why is it that we are having so few tests being conducted, not only in California, but just all across the country. Where's that disconnect, and how do we, or what needs to happen in order to apply the proper testing to get a real good handle on this virus?
I think it's a good question, and there's a little bit of a before and after. I think part of it was a political reality for key stakeholders to mobilize the resources needed from a federal level, maybe even on a statewide level. Usually those go hand in hand, of the severity of this infection and where this was going to go. And without getting too much into the weeds of that, because we don't need to get into the weeds of that, that might have been as much the issue. Because testing this virus, to take a step back, determining the code of the virus, we're in such an amazing time right now. For us to sequence, to do the genome sequencing of the virus was something that we could do within a few weeks. I mean, in our lifetimes, that you couldn't say that. Even within 10 years ago, to be able to get a DNA, the RNA sequence of a virus so readily and so quickly, was not something we could do many, many years ago. But what has to catch up is all the other components. After you've sequenced it, then you have to create a test that can match up to and help you detect if you found that viral sequence. And then once you've created that test, you have to have all the reagents that go into it. Then you have to decide, after you've created those tests, is how are you going to mass produce those? And in certain countries, that's being handled on a national level and a federal level. And to my understanding, that's certainly what's happening in South Korea, is that this is being handled more on the federal level. Whereas here in the US, it's been handled more on a private industry level. So we know that private industries, Abbott and I think Roche and a few other companies have now really invested quite a bit, and now testing is now getting to be more available. But there was a bit of that lag, right? And that was difficult. You asked also about the age ranges of folks. So this is a very highly contagious infection. And what the fear is indeed the folks who are going to suffer the most are the folks, again, who have an immune compromising issue. And we should speak about that in a moment, because I think it's important for all of us to know very specifically what those health conditions are, because it affects all of us to one degree, or it could affect all of us to one degree or another. But going back to highly contagious infection, and so 30-year-olds, 40-year-olds, and 50-year-olds, and as much as 78, being older doesn't mean you're more likely to catch the infection. It just means you're more likely to deal with negative consequences. You're more at risk of the deleterious effects of the virus, right? So we need to protect those populations more. Although, yes, 20-year-olds, 30-year-olds, 40-year-olds, and 50-year-olds are getting tested, and we're finding a lot of positives in our county. The other factor that might be showing that is, we have a very highly educated county. And could it be, these are sociological questions. That is it that we have a highly educated population, with many of whom have a lot of resources, who are very apt to get tested. A lot of the fear and anxiety that may have driven them to go get tested. Is that why we're seeing such a large number of folks 30 to 50? It's an interesting sociology sort of question, I think.
Yeah, one of the things that you talked about was, just the speed in which we can, diagnose or evaluate the genome of the RNA, right? And just over these last, like the last decade, the ability to, with technology to, really speed things up. And of course, in our daily lives, because of technology, we just expect things to happen right away. We want the results tomorrow, yesterday, right? So, do you foresee, the potential of a test that people could buy at the store, say 2-3 years from now, or could it be sooner, where then they can, in the privacy of their own home, determine whether or not they have the virus?
Yeah, I mean, I think you're right. I mean, from the first part of your statement about the nature of modern day living is on-demand TV and food delivered to your door, and now groceries delivered to your door for many of us. So yes, and this was a novel virus, right? So to create at scale testing. For instance, if tomorrow there was an influenza pandemic, and God forbid that ever happens, a widespread influenza pandemic that is severe, we would see some of the same issues. So even as a virus, which we've known for a very, very long time, we would see some of the same issues that we're seeing now. Now, hopefully, the response system on the local and federal level in terms of disaster preparedness would prepare us for the types of equipment and steps you need from a testing standpoint, the reagents, the chemicals you have to put into the test that allows them to work, and the actual testing cells and the substrates you need to develop those tests. So hopefully going forward, but again, we were starting from scratch, and there's no question about that. This wasn't something that the sequencing hadn't been done before. I mean, this was just done in the last couple of months. So the speed at which I think the healthcare system is responding has been really remarkable. The idea that a vaccine, for you and I mean, from a lay perspective, a vaccine taking 12, 18 months seems terrible. But from not just from the regulatory standpoint, but even from the patient safety standpoint, that we can cut the bureaucracy and really focus in on the safety questions and get that sorted out in potentially 12 months is remarkable for a vaccine. I mean, this is, anytime you read that, believe it. I mean, it is really remarkable that in our lifetimes, we can see a vaccine made in 12 months. We may see it get faster in the future as technology gets better, but that's never been done before. Think about the polio vaccine, how long that took, and all the other vaccines we take. It takes years and years and years. To your second question of at-home testing. So that's, it's an important question because that plays into a question a lot of us are asking is, when can life get back to normal? When can I go back to work? When will my employer let me go back to work? When can I see my loved ones? I'm on a quarantine right now for 14 days from my parents. I would love to know if they'll see me. Having an answer to that right now would be great, to know if I'm infected or not, do I have immunity or not. And there's a couple of key questions that have to be answered on testing though, before I think it's safe for any one of us to bring it home. I alluded to before on the viral test, the swab. Swab has to go really deep in the nose. It's not just in the outside of the nose, it goes really deep. And if it's done properly, it's uncomfortable. So if it's going to be home testing, are we going to be able to do it right? If it's a nasal swab, it's doubtful that many of us would do and get adequate sampling if we're doing a nasal swab. A blood test, how many of us would feel comfortable doing a blood test and getting an adequate sample? Is it a cheek if we're getting skin cells from you've heard about 23andMe and getting your genetic testing. If you look at the issues they've faced, even with at-home genetic testing, where they mail you a kit and you swab your cheek, and how many times did they have issues there? So the fidelity of the testing has to be sorted out, and that's issue number one. Issue number two is a very important privacy one. So in as much as we want to get back to work, having a positive or negative test result, our employers, our insurers, the stigma from our friends and family, these are real world questions. They're talking about in China that testing that there might be something on their mobile phones that shows are they positive or negative. But we have to think real world to ourselves. Do I want my neighbor to know if I've been infected or not? The privacy issues that come with knowing the answer to that. If you're not, so I think I think it's a big can of worms, the at-home testing, and both on ensuring the fidelity of the test and then what do we do with the results of the test, not just from a social standpoint, but even from a medical standpoint. I think there has to be a lot of societal input into that before maybe creating that test. To your question, Mr. Lentz, I think creating that test may not be the hard part. I think making it appropriate for all of us, I think that might be the harder question.
Yeah. Okay. Yeah. And just this will be my last question thing. You know, I'm blanking out on the name of the company that has the thermometer where people are, you know, they're collecting the data to see if they have fever. And it was, you know, originally set up for influenza, not for COVID. And so that information, I mean, so we are kind of already doing that, and then using it to identify where are the hot spots for people who have fever, and there's probably a good chance that, you know, they could have COVID. So yeah, but you're right. There are definitely some civil liberty issues that we need to, you know, also balance out. So that's it, Karen. If you have some questions too, or I see there's a couple more questions in the chat box.
Yeah, and those are all good ones. I mean, this is bringing up, I think, for society and our healthcare system, so many questions and real world questions that it needed to be addressed one day, and today is that day, right? So I think all of us are faced with some really tough questions. The next question I'm seeing is, as we see that it appears COVID causes the immune system to go into overdrive, are there ways to help prevent this from happening, i.e. vitamins? Really good question. The immune system is tricky. We need the immune system to be really effective, right? If our immune system wasn't effective, we would get bombarded and infected left and right and get really sick left and right. What makes this virus, so there's a couple of components. I want to unpack this question. When people end up in the ICU on ventilators, it is related to an exaggerated immune response, which leads to excessive inflammation and leads the lungs to effectively, in so many words, shut down. And that's problematic because that's what people are dying from. So that's where the immune system is maybe gone a little bit too overboard, in that it's triggering an excessive inflammatory response. But for the vast majority of us, we need that very same immune system to keep this virus under check. And for the vast majority of us, the inflammation stays in check and it controls the virus. We get a couple of days of cough, fever, shortness of breath, maybe, and then it goes away. So that's the double-edged sword of the immune system. And it leads to a lot of really good questions. I get asked this question quite a bit about what can we do to help our immune system. And it's almost the question of, but then, you know, if we help it too much, you know, then that's bad too. There is no such thing as helping it too much. What there is putting substances in your body that may not be effective. And that's where there's a lot of misinformation out there. And I've tried to, through my channels, certainly on the physician side, in creating advocacy for clinical, you know, for doctors and for nurse practitioners and nurses, because folks are asking us this question a lot about remedies they've heard of, or herbals or vitamins. And it's not to discount that in the history of mankind, those have been helpful. But the flip side is that there are also not very much hard data on those, despite the fact that they've been studied. So zinc and vitamin C. If you ever hear the anecdote in medical school, it was the story of Linus Pauling. I'll just give you this cheesy little story. But Linus Pauling, you may have heard of him, he was this famous scientist. I can't tell you all of what he did, but he was a big advocate of vitamin C. And so he believed in it so much, you know, antioxidant effects, good for the immune system. So he took mega doses. And so much that he became toxic. He got kidney stones, kidney issues, and he passed away from it. So, and this was a world-class researcher in vitamin C. There have been studies on zinc. There's been studies on vitamin E, echinacea. And this conversation tends to get a little bit political, which I don't want it to get into. What I want to stay with is what we know factually in terms of what I've seen real world and what I think the data has shown us is that vitamins, we don't have a degree of certainty if they are protective. What we know is protective are a handful of things: staying hydrated, staying active. So even on lockdown, getting outside, staying active, getting some sun, staying socially connected. We know that that helps people in tough times, as much the mental effects of this disease or the anxiety and the stress that a lot of us are bearing. A lot of us are bearing on our own. And as much as the mind-body connection, which I do believe in, the mental health effects of this disease have been bad. And I think we're going to start seeing the data of folks who are dealing with anxiety, depression, or maybe even suicide. So staying socially connected, whether it's using Zoom meetings or phone calls, talking to your mental health professional, if you have one or need to, are going to be important factors. So from the holistic, I took the question about the immune system to a broader holistic thing, but I think they're related. That, you know, you talk about immunity and what are things that we can do to help ourselves and protect ourselves. There's not much more than the bread and butter, but the bread and butter will take us really far. Next question here is the lung tissue inflammation I've read about resulting from COVID-19 sounds like a form of fibrosis. Is it that or something else? That's a really good question. So my clinical interest before coronavirus and for my whole career has actually been in lung fibrosis. So I like that question because I feel like I can really dive into that. So there's forms of lung fibrosis that many of us get. There's three categories. One is idiopathic, one is autoimmune, and the other is related to exposures. So in the category of exposures, and where this would fall in, is a post-infectious fibrosis. So talking about inflammation releases a lot of inflammatory mediators in our lungs. Oxidants are released. So cells that are fighting, neutrophils, largely some lymphocytes, as they're activated, and in an exaggerated way, they're releasing chemicals, enzymes, if you will, that destroy tissue, normal healthy tissue. Does everyone who gets COVID-19, who ends up on the ventilator due to severe lung inflammation, get lung fibrosis? That's part of the question. Okay, the first part of the question is, folks who generically get COVID-19, do they get enough lung inflammation to cause lung fibrosis? And the answer to that would be no. So to reiterate, the vast majority of folks, and there may be those of us on this phone, on this town hall, who may have had coronavirus, we have extremely low reason to fear, really no reason to fear of developing lung fibrosis with mild infections of coronavirus and with COVID-19 infection. It's really the folks who get the severe inflammatory responses in which, the cells are all recruited into the lungs, the neutrophils, the lymphocytes, they're releasing all these enzymes. Those enzymes can destroy tissue, and that leads to scarring or fibrosis. And that can lead to many people having long-term consequences of this infection. You might be wondering, what do we know about that so far, epidemiologically or sociologically? We don't know much. There's not been, and there's never been a good way to track patients who, even before coronavirus, whether it's influenza or other infections that lead to lung inflammation, post-infectious fibrosis. There's never been a good way to track patients like that. So we don't know how many or what percent or severity with coronavirus And unfortunately, and that also applies to other viruses too, though. So really good question.
Okay. It looks like that was the last of the group chat questions. I think what would be great to do now is, since we have 19 people waiting in line here, on the bottom of your screen, you'll see participants. If you would like to ask a question now, can you just click on participants, and on the bottom right-hand side, it will say raise your hand, and then Ingrid can unmute you and you can ask your question. No questions? All right.
I see no hands up.
Okay, so it looks like everybody is happy with the way you answered the questions, Dr. Gupta. So moving forward, I just want to say again that, you know, we are recording this. It's going to be on the blast. It's going to be on our website, on Facebook, etc. So moving forward, and I'm just going to go down here, make sure that we didn't miss anything before we move on. Just so everybody knows, we are on calls Monday, Wednesday, and Friday, getting updates from the county. There are 20 cities participating, and I've never seen anything like this before, where everybody from every city is participating in an incredible manner. And the staff at the county are doing such an incredible job. It's quite mind-blowing, the resources that they've pulled together, the amount of experts who are working together. And then we get somebody like Dr. Gupta, who is in our own community, volunteers to jump in and you know, be our answer person, and he's going to make himself available if we need him moving forward to answer questions or whatever might be needed. But from the county's perspective, they're putting together so many resources besides what Sharon and a few other people here in Brisbane put together, the PCRC, the website for our local people to be able to ask for help, whether it's help buying groceries or changing a light bulb or whatever people may need in this time, especially when we're really, really asking our elder people, don't go out, please don't go to the store, we'll go do that for you. So we had our own resources up so incredibly fast. Thank you, Sharon, for that. And John, I know everybody from the Lions Club and around were just working so hard to get that out within a week. But then I see the same thing happening at the county. The amount of resources that have been pulled together, and it's still fluid, it's still moving, and it's still improving. And for people who are trying to apply for loans and assistance, I know it's a little frustrating because it's such a fluid, moving situation that's going on right now. You know, trying to get the SBA loans and whatever. So the county has so many different resources, and thank you, Caroline, and the city. I've got to totally thank the city of Brisbane for their jumping in and being incredibly fast moving with putting the resources together as well. So Caroline has put some slides together, and we are going to try and put out often and in as many places as possible the up-to-date information that comes in from the county and everywhere else that is, you know, valid information for the people in our communities relative to emergency childcare, emergency loans for businesses, personal loans for whatever reason. There are so many resources that are available. And I'm just looking at the notes from today. I mean, every day there's pages of notes from when we get on at these calls. And oh, one thing I did want to put out to everybody is we currently have in San Mateo County 1,700 registered volunteers, and we need a lot more. So if you could spread the word, and we'll get that out as often as we can as well. volunteers at smcgov.org. This was new that came up today. And Samaritan House is completely overwhelmed with people trying to get groceries. There are so many unemployed people right now. The whole situation is fluid. It's overwhelming, but the response from everybody, including staff at the local level, staff at the county level, and of course, all of the volunteers within the community is just completely amazing. Cliff, what would you like to say about that?
Yeah, no, I thought that was a really good update, Karen, about what's happening at the county level. And yeah, you think about the amount of volunteers, right? So I think there are over 1,700 volunteers that have applied for service within the county. But here you have little Brisbane, right, which 4,500 people, and we're over 80 volunteers, right? So that's so impressive. And whenever there's been a response, or a request, there's been an immediate response to help that person out, and we're taking care of business. I know there was a slide that it's called helpful links or useful links from the county. Do you have that slide, Caroline? You can show.
Can you share it now, Caroline, or am I, hang on one second, I may have it here. I'm looking at these attachments. And again, don't shoot me for not being perfect. I can't do all of that.
Do you want to go through the slides now?
I think Sharon wanted to say something.
Okay.
Can we unmute Sharon for a second, and then we'll go through the slides because they're pretty. Did you want to say something, Sharon? Yes or no? No, she doesn't. Okay. All right. No, she doesn't. So yeah, we can go through the slides. And what we would like to do is update them as we get more information and put them out in as many places as possible. One of the most impressive slides today was looking how our 6 counties are really the leaders in the nation for flattening this curve. We jumped on it. We were really aggressive with suggesting that everybody shut down, step back, go home, go do your gardening, don't go anywhere. And everybody did it because everyone was smart enough to realize what was going on and the ramifications if we didn't. And when you look at what we did in the 6 counties in the Bay Area versus anywhere else in the world, we kind of rocked it. And that first slide that Caroline put in this slide set, which is going to go everywhere. So the whole idea for us is to put the information out in as many places and as often as possible. So, if you're not here tonight, you might pick it up tomorrow on Facebook. You might pick it up from an email from the city. You might pick it up on the city's Facebook page, whatever, that we're going to get the information out as often as possible and get it updated as quickly as we can. So Caroline, it's yours.
Yeah, if you could just go back to that slide, Caroline, and just I just wanted to emphasize, what's so important about this slide, right? So this is, did you see that gray line? That's the peak, right? That would have been the amount of people being infected if we didn't implement the social distancing. So we would have 5,349 cases. That would be the top, right? So there'd be in the thousands getting up there and in the thousands coming down. If we did a 35% reduction, we would have 2,500 cases. And you see the curve moves out as you, when you do your sheltering in place. But because as you mentioned, Karen, we've done such a good job, right? Our curve is that blue line, right? That's where we are right now, and that our peak will be 275 cases. So you could be at 5,300 as a peak, or where we're going to be at 275. And that's why it is so important to continue to do the shelter in place. Now, another thing that's really interesting about this slide is that you see that the curve goes way out into the fall, right? And so this is something that the county is working on. The governors, you know, on the West Coast are working on. It's like, okay, how do you open up society? You know, what are the steps you're going to take? And as Dr. Gupta had also mentioned, you know, it's not going to be something that's you're going to do right away. It's something that's going to take these little steps, right? Because we do not want to see a spike. But of course, we also have to try and get back to some resemblance of normalcy. So what we're doing is working, and here's the evidence of that. The next steps are, of course, we're going to need more, involved testing, right? More people need to be tested in order to be able to identify where these people who have the virus, where these hotspots are, and where we can deal with them in a more intelligent way rather than this wholesale, you know, sheltering in place. But this was a great model right here.
Okay, I'll go through the prior slides. Okay, we'll start from the beginning here.
Ingrid, do we have the slide from the county of the useful links? I didn't see it when you were going through them.
I did see it, Cliff. I'm not seeing any of the slides right now, but they are going to be added to the end of this presentation. So they will be on YouTube. And then I know Caroline is going to be reproducing those to, you know, through the blast, etc. I don't see anything right now.
Okay, yeah, here it is. I mean, it's in a different format, but yeah, no, this thing is just, it's really awesome. You know, all these sites that you can go to, and you know, for example, you know, if you're a small business, right, and you're trying to get answers to how to apply for SBA funding, or how to apply for SMC Strong funding. That's the local version of getting assistance. And one of the things that's cool about San Mateo County Strong is that your legal status, right, isn't a criteria, right? So you could be someone who is undocumented and you could still get support, unlike the federal stimulus money where you know, you need to have a social security number. One of the things that is really cool is the San Mateo County Health Dashboard, and you can just go to the county's website if you wanted to you know, kind of understand, you know, how many cases and how many deaths. One of the things that is, you know, just really hopeful is that we've been at 21 deaths for a long time, right? So there has not been any new deaths for several days. So, you know, and that when you understand like how many people have gotten the virus is difficult to say because of just the very low numbers of people who've been tested. But we do know about how many people have died, right? You're gonna be able to get that data. And yeah, over the last several days, no one has died from COVID, which is very, very good news. And then you know, if you have issues, you know, in regards to evictions, you know, right now there are the safeguards for the tenants. Karen, do you know of any safeguards for commercial tenants right now? And
they're still working on that. Actually, Congresswoman Jackie Spears' office is working on the commercial side of things. We will just keep getting these updates as soon as they come to us. One of the updates we did get this afternoon was relative to job openings that are opening up in our county, because obviously there's been a whole bunch of jobs that have closed down that we don't know when they're going to come back, if ever. But through Assemblyman Kevin Mullen, onwardca.org, just the word onwardca.org, relative to job openings. That's going live tomorrow morning. So, you know, for people who are looking for work, even if it's, you know, temporary gig work, trying to get money in people's pockets is really important right now. And really all I can say is that all of these websites are a work in progress. They were put together so incredibly fast. Some of them are working better than others. Believe me, people are working around the clock right now. The hotlines are going to be open as of Monday, I believe, from 8 a.m. to 8 p.m. for, you know, economic development, for job openings, for asking questions about SBA, et cetera, et cetera, et cetera. The other thing that is happening is all of the documents that were put together in a really short period of time are being translated into other languages, and they will be videos on YouTube as well as PDF documents. So this is a huge undertaking that sort of caught everybody out in left field. And I just have to say, I'm super proud of the place where we live.
Absolutely.
And I hope we can do this again. I don't want to keep everybody here just sort of going over and over and over the documents. I think from a city council perspective, we can probably get some more information, you know, through the city in conjunction with the city manager and our attorneys of all the things that are coming down the pipe. And unless there's other questions that people have, we probably should just let people say, see you later. And Dr. Gupta, so grateful for having you step in and say that you're willing to help. And, you know, hopefully we can, you know, hold on to you and figure out some other ways to utilize your expertise and get questions answered, but that we'll talk about that offline. Anybody else got any questions before we say goodnight? Cliff, got anything else you want to add?
Just super quick, just off this list, if you know of someone who's an essential worker and they have kids, right? The state just announced that they will provide financial assistance for your childcare. And that is so important. You might have someone you know that works at Trader Joe's and they got a couple of kids, right? The state will be able to cover that. And then the other thing that you had mentioned, Karen, about Samaritan House, and that, you know, lines, you know, down the block of people needing food. So we have some local food relief places, one of which is Jefferson High School, Bayshore High School. And then the Lions have been partnering with Peter Styler to provide food. And I know that John Mazza from the Lions is on the line, and they just had their meeting last night, and they came up with a lot of like really great things to help the community. And John, if you want to just touch upon them, that would be great.
Too. Thank you. And thanks for this meeting. The Lions have been fortunate enough to be included in all the coronavirus efforts by the city. And last night we had our first virtual meeting, and it went well. We have had some very generous families in town dedicate some funds specifically to coronavirus relief help. And we are partnering those funds with Peter Steeler for food sharing and food delivery to needy people. In one aspect, one of the donors specifically set aside a large amount of money in the many thousands of dollars to augment his ability to shop for groceries. And we are piggybacking on his existing process to augment that with those resources. Another thing that was brought up by, again, just, you know, the loving members of the committee of the town was, could we do something and to facilitate showing our appreciation for the coronavirus workers who are the police and the fire and the post people and the people who keep us running every day by taking their donations, these private citizen donations, and converting them into gift certificates for the local restaurants, so that these can be distributed to the people who, you know, keep the machinery running. And that was another a great you know, step up by our citizenry.
Mm.
The third thing that we just touched on last night is that, you know, as you know, the Lions has one of our best events every year is the senior luncheon. So we've kind of got a tie-in to just about everybody in that population. And what we want to do there is we want to do kind of a wellness reach out check to everyone through the mail to start to see if we can identify those that, you know, may not be vulnerable now, but maybe, you know, who knows how long this goes, and kind of keep a watchful eye on that entire population, which is, you know, well over 200 or so individuals. And fourthly, Lion Allison, who we all know, and with the Chamber of Commerce, was able to secure a grant from the Lions Club International Fund to be donated to Seton Hospital, specifically for augmenting, you know, their budget to be able to address those that do need hospitalization. And in fact, the first application of those funds happens this week with a call nurse, which is the first line of defense. Do I come to the hospital? You know, here's my symptoms, that type of thing. So this is all borne by the generosity of the citizenry, really. We're just facilitating it and kind of co-opting the various delivery mechanisms that already exist. Have I forgotten anything, Lion Sharon? Okay, so that's kind of it in the synopsis. And we're so fortunate to live here, and it's such a privilege to work with all of you guys. So thank you. That's all I got.
Thank you, John, and thank you to all the Lions for doing an awesome job.
Okay. All right. So once again, this is going to be on the Brisbane YouTube channel. YouTube.com/Brisbane, California, to see a rerun of this. This is our second virtual town hall. We hope you enjoyed it, and hopefully we'll make them better as we go forward. And one of the things that I always say to people is, you know, we have great ideas. The city has great ideas. Dr. Gupta has great ideas. The Lions Club have great ideas, but we're not the only ones with great ideas. If you've got a great idea or you've got a suggestion, please bring it forward, because together we're going to make a better situation for everybody. Take care, everybody, and we will see you next week. Actually, we'll see you tomorrow night. Good night, everybody.
Good night, everybody.